Federal data shows the Delta variant of COVID-19 may be as contagious as chickenpox and cause more serious illness. Here to answer your questions is Dr. Ali Raja, the Executive Vice Chair for Emergency Medicine at Mass General Hospital. Good morning. We have heard about this COVID being compared to the flu, doc, but never chickenpox. Why put the Delta variant in that same category?
It's a good question, Rondella. It's an accurate comparison, but it's not what I'm focusing on those internal CDC slides about. What the document does is it compares the transmissibility of a number of viruses, including the Delta variant and the chickenpox, like you said. But it talks about like the common cold and Ebola and a bunch of other viruses. And yes, the Delta variant is very transmissible. In fact, the data support that in areas of the country and even in the state where we're seeing patients with a lot of COVID, we need to put masks back on. But the internal data also show that even with the Delta variant, the vaccines prevent more than 90% of severe disease. That's what I'm focusing on.
Okay, that's a little hopeful. In many ways, it seems that the Delta variant is an entirely different disease. What worries you most about it right now in terms of what you're seeing in the data?
I've heard that, and I know that a lot of people are really worried about that. But right now, it's just a different version of the same disease, Rondella. The current vaccines work, and we expected that the virus would do what viruses do, which is change slightly over time to different variants. It's a good question about what worries me. What worries me is it's not the breakthrough cases for vaccinated people, but the severity of the illness in unvaccinated people. Over 90% of hospitalizations and deaths in the country are in unvaccinated people, and that's what really worries me right now.
That's another call to get your vaccine. You work in one of Boston's busiest ERs. Is the Delta variant changing anything about the way you evaluate the patients when they arrive?
It's not. We're still screening for COVID symptoms in everyone like we've been doing for a while. We're still wearing masks all day, and we're using PPE whenever we're evaluating someone who might have COVID. Fortunately, we have enough PPE, and we're very, very good at putting it on and taking it off. We've had a lot of practice over the past year and a half.
I bet. Being a doctor, but you're also a dad of young children at home who aren't eligible for that vaccine yet. Are you going to take any extra precautions as a parent to keep them safe?
It's a really good question, Rondella, and one that we've been talking about with our friends and family all the time. We're following the guidelines, which here in Massachusetts have really been evidence-based. Our kids are wearing masks indoors like they have for a while. They'll be wearing them in school because they're too young to be vaccinated. And really, most importantly, once we start seeing data for younger kids and assuming that the vaccines are as safe in them as they have been in other people, we're going to get them vaccinated.
Very good point. And kids do good with routine, so keep the mask, right?
That's right.
Dr. Ali Raja, the Executive Vice Chair for Emergency Medicine at Mass General Hospital, thanks again for joining us. Have a great day.
Thanks, Rondella.